Welcome back, James. Very nice to see you this year. How are you feeling today?
I'm okay. My shoulder hurts, my right shoulder.
Okay.
I was playing the piano and I must have done a wrong move.
Okay. So you're here for a shoulder joint exam.
Yeah.
Okay. I can do that for you today.
Thank you.
Before we begin with the exam, let me make sure that I have the right chart. Can you please verify with me your date of birth?
June 7th, 1983.
So I have the right chart. Do you still have the same insurance as last time? No. Same insurance. And are you on any new medication?
I'm taking ibuprofen.
Ibuprofen for the pain?
Yeah.
Okay. And did anything change in your history since we have met last year? No. So no major surgery, no other major accident?
No. I got new gloves, leather.
You got new gloves?
In my car, yes.
Very good. So tell me what happened.
Yeah, so I was playing a song and I think I just got a little too into it.
Okay.
And I must have just, really pressed the keys hard and something just kind of popped. And
so it sounds like maybe you pulled a muscle in your shoulder?
Yeah, it could be. I mean, it was a very intense part of the song.
Okay. And on a scale of 1 to 10, how would you rate your pain right now?
10 being the worst.
10 being, I need medication, I need you to do something for me right now.
Oh yeah, I mean, yes. But, it's not like, maybe 7.
A 7? Okay. And can you lift your shoulder right now?
Yeah, when I do this, it hurts a little bit.
Okay, so it sounds like you still retained a little bit of mobility, but...
Yeah. You know what hurts? I can't lift.
You can't?
That hurts.
Okay.
Yeah.
And you mentioned that you took some ibuprofen for your pain.
Yeah.
How much did you take?
Just 2 pills, maybe twice a day.
Okay. And did you try any cold patches or heat patches?
No, I never know which one is which.
Okay. And when did the accident happen?
It happened 2 nights ago.
2 nights ago, okay. So you've been in this much pain for the last 2 nights?
Yeah, it didn't get better.
Okay, that's no good, so definitely we should help you out. So what I'm going to do is, I'm going to first start by taking your vital signs.
Okay.
I will then do a visual inspection of your shoulder just to make sure I'm not, missing any external signs that may indicate a particular diagnosis. Then I will quickly palpate your shoulder to make sure that bones are broken, nothing major is happening, which I don't think so because you're able to lift your hand, your arm all the way up. And then we will do a couple of sensation tests, some nerve examinations to make sure that your nerves were not damaged during the accident. I'll be checking your reflexes, and then we'll do a couple of range of motion tests that will help me narrow down to a diagnosis.
Okay.
Okay?
Dr. Lux, do what you gotta do.
Okay, and we will finish up with the massage. And I also have here a acupressure device that we can use to stimulate the blood flow and the energy flow through your muscles and make sure that we get energy moving in your body, and that will hopefully speed up the healing process.
Okay.
Okay, sounds good?
Yeah.
Okay. So let me just make sure I have all that information. Okay, very good. Okay. Would you like some?
Yeah, please.
Okay. Can never be too careful nowadays.
Yeah.
So much sickness in the world. We gotta be as healthy and careful as possible.
You're right, Dr. Lux.
Okay, so you were playing the piano when this happened.
Yes.
That must have been quite the song.
Yeah, intense.
So you're playing the piano when the accident happened.
Yeah.
Do you remember what song you were playing?
Yeah, you know Mozart's Rondo Lazurka?
Mozart, okay.
I was playing it, and you know it has some intense parts.
So you're giving it your all.
I was trying.
Okay.
I don't know if it was sounding good, but I was in the moment, and that's when this happened.
Well, I'm very sorry about this, but I'll do whatever I can to help you
Thank
today.
you.
Okay, so let's start by taking your vital signs. Have you been sick lately at all?
No.
Cold or any other viruses? Okay, that's good. So this is going to go over your forehead. 98.5. That's a very good temperature. Good that you don't have any fever today. Let me quickly check your oxygenation levels. Maybe we can try the other hand. Yes. And your heart rate. So just take a deep breath, relax for 10 seconds. 9, 8, 7, 6, 5, 3, 2, 1, 0. Okay. 98% oxygenation level, heart rate of 80. That's very good. Let me quickly take your pulse. I will lift up your arm, no worries.
Okay, thank you.
Okay, let's count back down from 10 together. 9, 8, 7, 6, 5,
4, 3, 2, 1.
Okay, very good. And I'll also check the pulse here. Okay, very good. So, good temperature, good oxygenation levels, strong pulse. So far, so good. Let me just quickly listen to your heart and lungs with my stethoscope. Okay. Just relax. So I'm listening for any murmurs, any swishing sounds that may indicate valve abnormalities or anything wrong with your heart. And I'm definitely not hearing anything. Okay, I listen to with the bell side as well. I'm hearing S1 and S2, not hearing S3 and S4. So definitely no signs of heart failure, valve abnormalities, or anything wrong with your ventricular muscles. Okay, very good. Okay, next up I'd like to take a listen to your lungs. So if you could just take a deep breath for me in and out. Very good. One more time. In and out. In and out. In and out. In and out. Okay, so definitely your lungs sound perfectly healthy. And from the last examination I did, I remember you mentioned you are not a smoker.
No.
Okay, very good. So good, strong, healthy sounds coming from your lungs. Okay. Excellent, James. Okay, last thing I want to take is your blood pressure. And since you damaged your right arm, we're going to take your blood pressure over on your left. If you can hold this for me, don't strain your arm. Very good. Your blood pressure is a little bit elevated, 130/70, but that may be just because of the pain that you're feeling. Your systolic is a little bit on the high end as well. It's a little bit expected given that you're a 7 out of 10 on the pain scale.
Yeah.
So nothing to worry about.
You think so?
Oh yeah, absolutely.
That's good.
Okay, so I'm going to begin the shoulder joint exam right now. And I will first start with the visual inspection of your shoulder. Like I mentioned, just to make sure I'm not missing any visual external signs that may indicate anything wrong. So let me just take a look at your shoulder here. Okay, so I'm not seeing any redness or any scratches or any marks that may indicate, something wrong with your skin. That's very good. 2 days ago.
Mm-hmm.
Okay. Your tendon may be inflamed, which is the pain that you're feeling, but that definitely does not manifest as any redness on the skin, which is very good.
That's good.
So what I'm going to do next is I'm going to palpate your muscle. I'm going to start very softly, but if you do feel any pain, please let me know. Okay?
Okay.
Let's see. Does it hurt right now?
No, maybe a little sore.
Okay. Do you feel any pain in the front?
No.
And the back, how does this feel?
Sore.
Sore, okay.
is a bit sore.
Okay. So right here, when I press down, does it hurt? Okay.
No. Maybe a little bit.
How about when I press in like this?
Yeah, a little pain on the back there.
On the back side,
Yeah.
okay. So I'm definitely going to take a look at your scapula. Okay, how about when I touch your arm like this? Does this hurt?
No.
Okay, so your arm is okay, and your humerus bone is definitely not broken. You would be in a lot of pain when I'm doing this otherwise. Okay, let me check your clavicle. Are you in any pain?
No.
Okay, so your clavicle is definitely not broken as well. Okay, so how about when I press really hard on your scapula here?
Yeah, that hurts.
Okay, on a scale of 1 to 10?
7.
A 7, okay. So the pain is localized right here in the back.
Yeah.
Okay. How about right here? Do you feel any pain here?
Just maybe a little, not much there, maybe a little here.
Okay, right here. So a 7 here, 1 or 2 here.
Maybe 3.
Okay. Nothing here.
No.
And nothing in your arm either right here.
No.
Okay, sounds good. So let me just make a note of those observations. Okay. So definitely just by doing a visual inspection and a palpation on your right shoulder, I can definitely tell it's a little bit swollen when compared to this one. You don't have any pain here?
No.
Okay. So it is a little bit more swollen. But the good news is it doesn't seem like any of your major bones are broken.
That's good.
So nothing here and nothing in your humerus. Okay. Very good. So let's do a quick sensations test.
Okay.
This is the point of the exam when I'm starting to focus a little bit on your nerves, innervations in your shoulder to make sure that if there's anything major that was damaged, I can pick up on that.
Should I be worried?
No major red flags as of right now. Okay. So I have here a device. It has a dull, fluffy side and a pointy, sharp side.
I see it.
Okay. Now if you can turn just a little bit like this, can you tell me if you feel this?
Mm-hmm.
Okay. How about this?
Mm-hmm.
Okay. This?
Mm-hmm.
Okay. And how about this?
Mm-hmm.
Do you feel this?
Mm-hmm.
Yeah. How about this?
Yes. Slightly less.
Slightly less in the back. Do you feel this?
Mm-hmm.
Dull or sharp?
Sharp. Sharp.
Okay.
Kind of dull.
Very good.
Dull. Sharp. Sharp.
Very good.
Dull. Dull.
And if you can give me the arm. Do you feel this?
Definitely.
Okay, very good. Now I'm going to touch you with either the dull side or the sharp side. Let me know which one it is.
Mm-hmm. Soft.
Okay.
Sharp. Sharp. Dull.
Okay.
That's dull.
Very good. One more time.
That's sharp.
Okay, that was actually dull.
Oh.
So there is definitely something going on right here in this area. Okay, let's try one more time on your clavicle. I just want to make sure everything is okay in the front.
That feels like the dull part.
Yeah, and one more time.
Sharp.
Okay, one more time.
Sharp.
Okay, very good. Okay. Next up, I have here a neurological hammer, and I'm going to tap you and quickly check your reflexes in your elbow and your wrist. Okay? Any pain?
No. No.
Okay. And right here, I will lift up your arm. Any pain?
No.
Okay. Just for comparison, let's try on this side as well. Any pain?
No.
Okay. Any pain?
No.
One last time. Pain?
No.
Okay. So definitely your reflexes are okay in both of your arms. Next up, I'm going to check your innervations in your nerves one more time, a little bit more in depth. I have here a tuning fork.
Okay.
I'm gonna strike it and
I use one of those.
yeah, during your musical.
Sometimes, yes.
Yeah, very good. Yes, for tuning instruments.
Yes.
So I'm gonna create a vibration, and I'm gonna place it on the bony prominences of your body. Let me know first if you feel it, and then when you stop feeling it.
Oh, okay.
Okay. Do you feel this?
Yes. Now.
Okay, very good. Do you feel this?
Now.
Okay, very good. Feeling it?
Now.
Okay, very good.
Now.
Okay, let me try in the back on your scapula. Feeling it?
A little, yes.
Okay,
Now.
all right. Feeling it? Okay. Very good. So even though there was a little bit of a decreased sensitivity when I touched you with the fluffy puffy device, it does seem like your nerve endings are okay. I'm not seeing any major red flags. You do feel all the vibrations that I was making. So your nerve endings in the back of your shoulder, the front, your clavicle seems to be okay.
That's good.
Yeah.
I didn't know you could do that with your tuning fork.
Yeah, you definitely can. So let me quickly summarize. So, okay, able to feel all vibrations on bony prominences of shoulder, innervations work as expected. No nerves must have been, damaged during the accident that you had. Okay, next up, I'd like to take a couple of measurements of your shoulder to make sure that I have a reference point for when you're gonna come back and see me in 2 weeks. Okay.
Okay.
I do want you to come back and see me to make sure that your healing is progressing.
I don't mind coming to see you, Dr. Lux.
Okay.
I don't mind at all.
Just slightly elevate your arm, that's good. Okay, that's 15. That's 13. 11. And in the back, I'd like to measure your scapula. That's 9 3/4 longitudinally and 7 3/4 laterally. And if you can keep your neck right like that. That is a posterior measure of 8. Okay, very good.
That feels good.
Do just the baseline. Okay. So next up, we're going to do a couple of range of motion tests. And I'd like to assess the level of pain that you're feeling while doing these tests. So on a scale of 1 to 10, with 10 being maybe the most intense pain you've ever had, let me know, what do you feel?
Okay.
Okay. Do you have any pain right now in the resting position?
A little bit, yeah.
Okay.
I mean, just like before.
So maybe a 2 or 3.
I mean, when I came in, I said 7. I don't think it's 7. It's maybe like 4.
Okay.
But it's constant.
Constant, all right.
Yeah, it's a nagging pain.
And do you feel any sharp, needles?
No, it's like when I lift it.
Okay.
You know, it's
So constant
intense,
dull
but
pain.
then there's a dull pain.
All right.
Yeah.
So let's do a forward flexion test first. Just leave your arm loose like this. I'm gonna move it forward for you, gently. Okay. Do you feel any pain right now?
No.
No? Okay. Now, can you do the same movement by yourself?
Yeah, that's about right.
Okay, so only move it as far as it goes until it
Here
hurts.
it hurts.
Okay.
Yeah.
On a scale of 1 to 10,
It's like a 5.
a 5. Okay. So let's do the same again, but go all the way up. Okay, I'll do it for you. You can let your arm loose. Does this hurt?
Oh.
No? Okay. So when I do it for you, it does not hurt.
Yeah.
Okay. Now can you lift it up by yourself all the way up?
No.
No. Okay.
But here.
All right. Very good. When you lift it, 45 degrees on a scale of 1 to 10.
It's like 6.
A 6. Okay. Okay, now we're going to do extension next. If you want to let your arm loose over your body, and do you feel any pain right now?
No.
No? Okay. Now I'm going to move it back for you. Stop me when you start feeling pain. Does this hurt?
Yeah, a little bit.
Okay, on a scale of 1 to 10.
2.
A 2, okay. Now you do the same move by yourself.
Yeah, that hurts.
That hurts? Okay. Very good. On a scale of 1 to 10.
2.
A 2. Alright. Now, next up we're going to do abduction. I'm going to move your arm laterally. Stop me when it starts hurting. Okay. Does this hurt?
No.
No? Okay, very good. I'm going to try lifting it a little bit up. Does this hurt?
No.
No? Okay. Now, how about you try the same on your own? Lift it 30 degrees first.
Yeah,
45.
about here.
Okay. On a scale of 1 to 10?
4.
A 4. Okay. Okay. Next up, we're going to try to do cross-body abduction. I'm going to lift your arm up. Okay, just about here. This is when you start feeling pain. Now I'm going to move it across your body. Does this hurt?
No.
Okay, very good. Can you try maybe doing it on your own? Okay, so you can't really do it. Okay, very good. Now we're going to try internal rotation. If you want to lift it like this, I'll do it for you at first. Okay. Does this position hurt?
No.
No? Okay. Does this hurt?
No.
Okay. Now I'm going to try to bring it all the way up. Does this hurt?
No.
No? Okay. That is a very good sign. I'm going to put it in the resting position again. Can you do the same on your own?
It's about here.
Okay. Okay. On a scale of 1 to 10?
5.
5. Very good. So definitely, given the amount of pain that you're in, I'm able to see that you can do a couple of movements, even on your own. What I'm thinking is that the rotator cuff may be damaged and inflamed. Your tendon, your ligaments inside the joint, inside the shoulder may be inflamed. So my diagnosis is that of tendonitis, which is inflammation of the tendon. It doesn't seem too bad because you're able to do a lot of the movements that I've asked you to on your own. So I do believe that with some more ibuprofen and rest, you will recover in 2 to 3 weeks.
Okay.
One thing I do want to check is the mobility of your scapula in the back. If you can turn towards me.
Like that?
Yes. Okay, and I know that this was a lot of pain for you, so I'll do it for you. Okay. Slight pain when I touch the back of your shoulder. Okay, so your scapula does look okay, and I already checked your clavicle, so no broken bones. the humerus bone is intact as well. Okay, very good. Very good, James. Next up, I will try to help you a little bit.
Okay.
So like I mentioned, I have here an acupressure device. It's pretty much a stimulator. It does not use any electricity, and it's very similar to the concept of acupressure and acupuncture. Have you ever had that done?
Once.
Acupuncture, yeah. So it's meant to, send a sharp signal to your muscles and then facilitate the flow of energy in the area, and hopefully that will help and speed up the healing process. Okay?
Okay.
So first up, I'd like to mark the points that I'm going to use my acupressure device on. So those would be the bony prominences of your body. This will definitely help speed up the healing process and make sure that the blood flow is working as expected in the area. Okay. And one right here as well, why not? And don't worry, this will come off. It's water-soluble paint.
That's good.
Okay.
Is this gonna hurt?
No, just relax. Okay. Okay, next up, before you leave me today, I'd like to make a quick massage, and that hopefully will stimulate the blood flow and bring energy from the rest of your body into your shoulder, and help your tendon and your ligaments in your muscle heal faster.
That would be very nice.
Yeah, is that okay with you?
Yes, thank you.
Okay.
I appreciate that.
Of course. Okay, I'm going to be gentle in the back here.
Thank you.
Does that feel good?
That feels good.
Okay, just a little bit more gel. Definitely try to take it easy and make sure that you protect your muscles while playing the piano.
Yeah, I will do that, Dr. Lux.
Playing
I
the
just got carried away.
Yes, playing the piano is a marathon, so you want to be gentle on your body. I'm going to do a couple of circular motions to make sure that the blood flow is stimulated. You should start to feel better.
Yeah, it definitely helps.
Okay, very good. Okay, what I'm doing is creating movements from other parts of your body into your shoulder. To bring energy from across your body to your shoulder and your tendons that are damaged.
Now, Dr. Lux, would it help if I imagined any energy flowing anywhere?
It always helps to visualize anything that relaxes you.
Then I will do that.
Okay. Okay, James, does that feel a little bit better than when you first came in here?
It does, Dr. Lux, thank you.
Okay, very good. So let me just take a quick summary of what we did today. So, like I mentioned, my diagnosis is that of tendonitis. You must have made a very sudden move that, upset your ligaments inside your shoulder. I do want you to immobilize the arm for about a week. So unfortunately, no more playing the piano for a week.
Can I still play with my left hand?
Yes, you can definitely continue using
That's good.
your left hand. I do want you to continue taking ibuprofen every 6 hours 200 milligrams. Don't go any higher than 400 unless you are in a lot of pain.
Okay.
Okay. And no lifting any heavy objects. No painting in the house or doing any housework that requires you to lift up your arms. Try to keep both of your arms for at least a week. Don't bring them above your head.
Okay.
But the good news is that nothing is broken. Your clavicle, your scapula, your bones in your arm, they're definitely not broken. And based on the range of motion tests that we did, no major muscle seems to be broken. And your nerves and your innervations in your shoulder work as expected.
That's good.
Okay. So I do want you to come back and see me in 2 weeks.
Okay.
Continue following the advice that I gave you, and you should start feeling better in about a couple of days. Okay.
Okay.
All right.
Thank you, Dr. Lux.
My pleasure. I'll see you soon.
See you soon.